Welcome to the show. I'm so happy that you're here. You're going to be so happy you're here. I have Dr. Andrew Kadar with me. He has got a story to tell like you cannot believe. Some of you may have been through something similar and came out of it, and which is so great. I love it when people can share being on the other side of hardship and being on the other side of hard times. But Dr. Kadar, welcome to the show. I'm going to talk more about who you are as I talk to you. So thank you for coming.
Thank you for having me. I'm happy to be here.
Yeah, absolutely. So you are a doctor. You went to Yale. You've studied under the best. You've worked at the best. You're an anesthesiologist. You've done so much in your life. And you had a big thing happen. But before we get to the big thing, I'd love people to know who you are. I understand you are a gymnast and a runner. Is that right?
That's correct.
Yeah.
During college, I competed for the UCLA men's gymnastics team. I also competed in high school, and I don't compete as a gymnast anymore, but I do run.
Oh, that's awesome. That's awesome. So tell me a little bit about like your growing up. How did you go from birth to doctor? Did you always know that's what you wanted to do?
Well, no. It's actually a fairly complex story, but I was born in Budapest, Hungary, and my family escaped after the 1956 revolution. We're refugees for a year in Yugoslavia and then spent a year in Brazil before coming to Los Angeles, where I grew up and went to UCLA as an undergraduate and then decided to see the rest of the country and went to New Haven for medical school. Came back to Southern California. Spent a year at San Diego, a year at Stanford, and then finished up my residency in Boston at Massachusetts General Hospital, the Harvard program.
Wow. Wow. Well, that's quite a journey that you packed into about 30 seconds. So, how old again were you when you came from Hungary? How old were you?
I was 8 years old when I left Hungary and 10 when I got to the US.
Wow. And what was that time? What were those 2 years like for you?
It's funny. For me, it wasn't particularly tough. There were parts that were, but I think being a refugee was much more difficult on the adults because they had responsibility. When I was in refugee camps, there were lots of kids to play with all the time. We weren't brutalized, so every refugee experience is different. But mine was not particularly difficult, at least in my memory.
And so, well, yeah, well, that's kind of nice to know, but still, it's not what you want for 8 to 10 years old, I'm sure.
No, I mean basically we're most of the time we were in military barracks in bunk beds with about 60 people to a room, bathroom for women and bathroom for men at one end. And so it wasn't exactly luxury vacation conditions, but for a kid, we didn't have school, had lots of playmates, so I wasn't particularly put out. I think by the end of the year, I'd had enough because there was one of the camps where there was a lot of rain and we had to slosh through mud to get to the mess hall. So it wasn't particularly pleasant. I think it was probably much more difficult for I'd say for somebody in their late teens, early 20s, it would have been more difficult.
Yeah, kids are pretty resilient and kind of go with the flow a little bit easier, I think. And especially because you weren't necessarily concerned with what's the next step because you got your folks and they're going to figure it out for you. And so,
Yeah,
right?
I mean, I have to give a lot of credit to my parents in this because they kept my brother and I reassured that we were going to a better life. So don't worry about what's happening right now. Yeah, you lost all your toys and your friends, but we're going to America where things are going to be wonderful. So I believe
Mm,
it. And they were
yeah. So did you know any English when you landed at 10 years old?
When I took off on the airplane from Brazil, I didn't know any English. By the time we arrived, my father taught me how to say, Hello, Aunt Susan. Hello, Uncle Paul. Hello, cousin Michael and Paul. Michael and Stephen. Sorry, getting my
Yeah.
cousins and uncles mixed up.
So yeah, so you had at 10 years old, learn a whole new language, go to a whole new school, do all the stuff. I mean, that's a lot. That's a lot. And somewhere along the way, Andrew, you became a gymnast. Were you a gymnast in Hungary?
No. Well, I
Okay.
mean, I played at the climbing the walls and so on, the scales, but I never did any formal gymnastics until high school or maybe junior high. But basically, I competed for the first time in the 10th grade.
Wow. In 10th grade. And then you competed in college.
Hmm.
Most kids start when they're 3 years old or something with gymnastics, and you started way later than that and got to a level where you were able to compete in college. I so admire that. Like, did you just love it and just want to keep doing it and work really hard at it? Like, what was your motivation?
Yeah, I think I worked hard at it. I think initially I learned fairly quickly, and then of course I got to the point where it became much more difficult. But I enjoyed it, and the camaraderie on the team was great. Some of my best friends my best friends in college were gymnasts, and then I still have some of those friends today. Some of them who live nearby. Within the last week or two, I've talked to three of them actually.
Wow, nice. That's nice. That I love a long-term friendship. My best friend from high school is still my best friend. And there's something really special about a long-term friendship like that. Like
Mhm.
you
Yeah,
knew each other when, right?
yeah.
And the stories you can share and hopefully give each other grace that you can change
There's
and
a lot of
evolve.
history.
Right, exactly, exactly. So yeah, so then here you are, and you obviously really go after everything that you do. Like, you started out being a gymnast in 10th grade, started competing and competed in college. Like, that's amazing. That does not happen, right? And then you
Well,
went to
it
Yale,
wasn't that unusual for men's gymnastics in those days. I think
no?
it wasn't that unusual. I think a lot of people started a few years earlier, but a lot of my teammates at that time, I had a really outstanding high school coach, and I was in his first league championship team. He later on had many city championship teams in Los Angeles. So I had that advantage of a really good coach. And then in college, I had Art Sherlock, who was an Olympian, who was my coach. So I had good coaching and good teammates all along. And that I think is very helpful for anybody competing. But you
Yeah,
learn
for
from
sure.
your teammates.
Yeah, right, right, right. Well, and you must have done well grade-wise and whatever in school too. So coming at 10 years old, only knowing aunt, uncle, hello, and Paul, Stephen, and whatever, only knowing a couple words, to go from that to high school, you must have gotten really good grades to get into a good university.
Yeah, I was a good student.
Yeah.
I think
So
I was motivated. Uh, my father is an electronics engineer, and he had my family is Jewish background. So my father during it was in the 30s, he couldn't go to university in Hungary because there were laws against Jews being able to go. And so he had to go abroad to Czechoslovakia for his university education. So when I came to the US, it was so much easier for me. And I think that the saying was that in Hungary, people had to work so hard just to stay in not to fall behind. And when they got to America and they found out that they could actually get ahead, they worked even harder and got ahead. And I think
wow.
I was in that tradition.
Yeah, yeah, that's cool. That's cool. And then Yale, I mean, that's a big dream. I've got a granddaughter who's a senior in high school right now who hopes to one day be in medical school. And I I know the difficulty of getting into Yale. I mean, that's huge that you got into Yale. Were you just this incredible college student and did great on all testing and they just said, man, we want you so bad, Andrew?
I was a good student. I yeah.
Yeah, and here you are. Yeah. And you've done a lot in your industry. So you've been a leader in your industry. It hasn't just been you're not, just a doctor punching a clock, but you really have done so much. And I'm sure a lot of what you've done has really helped a lot of people.
Well, after my residency, my entire career has been at Cedars-Sinai, which is a big tertiary hospital in Los Angeles, and so it's been gratifying. I've enjoyed it.
Yeah, that's great. That's awesome. So then here you're going along, you're a runner, you're healthy, you're fit, you eat good, you do all the stuff, and then got this curveball thrown at you. What happened?
Well, one day I was working out in the gym, and all of a sudden I had some burning in the center of my chest. Stopped, it went away, and of course I thought about heart disease. I mean, everybody knows that's chest pain is a presentation of heart disease. More than that, I knew that the most common presentation of coronary artery disease is pain in the center of the chest that comes on with exercise and goes away promptly with rest. I also knew about denial, which is the tendency for people to write off something that's happening to them. No, it's nothing. This lump, it's not so big, it's not so hard. Forget about it, and the tumor grows. And so I knew about denial. I knew how coronary artery disease presents. And yet when it happened to me, what did I do? I went into denial. But 3 days later, I was back in the gym and the exact same thing happened. Now, this time I thought, okay, I know I don't have heart disease, but what would I tell anybody else who had the same symptoms? And then the answer became obvious. And that's, I think, the first lesson to me in all this is that the best way to get over denial is to think about what would you tell somebody else who had those same symptoms? Because then you separate from yourself, you can be more objective. And I think that actually works for hypochondria as well, because if somebody else tells you they have some minor problem, you're not going to think the worst right away. So I think trying to be more objective is a good thing. So then I called my doctor, had an appointment made, and that's actually the second lesson to me. And that was when I first called my doctor's office, I was told, well, the next appointment available is in 18 days. Now, I knew that this was a little more urgent than 18 days, but when you call the office, the person who's making a scheduling, it's on a first come, first served basis, unless you can override that. And then when there's more urgency, you have to talk to somebody who can override that. So I asked to talk to my doctor, who did override it, and I had an appointment for a stress test in a couple of days. And when that came, I was still hoping that it was something mild, but when I looked over, by then it was after about 2 minutes or 2.5 minutes, I started having the same pain.
Mm-hmm.
And so then we knew that it was most likely coronary artery disease at that point, but I was still hoping that it would be something that could be fairly simply fixed. There's a procedure called an angioplasty where you just put a catheter, it's plastic tubing that you snake into the blood vessels in the heart. You dilate the blood vessel, and then you can go back to work the next day. But when I woke up from the procedure and the angiographer was there, and I said, did you do an angioplasty and how many vessels? And he said, I'm going to get a heart surgeon to talk to you. So then I knew that the news was bad. And the following day, I was having open heart surgery. The diagnosis was actually a 3-vessel disease with one of them, a blockage in the largest artery that feeds the largest portion of the heart. And that's known as the widowmaker because it so often results in sudden death. So I was fortunate to have the surgery at that time. Now, when I first was told I needed the surgery, I was going to have sort of the fastest recovery in the history of open heart surgery. When I was in college, I thought that doctors routinely exaggerated the amount of time it takes to get over an illness, because the guys that I knew, they'd be told, "Oh, you know, to get over this injury, it'll take you 2 months," and in 4 weeks they were back in the gym doing everything. I didn't realize that my sample wasn't typical, because young athletes who are highly motivated and in great health get back faster. But in my mind, I was still that young gymnast, so I thought, I get back to normal pretty quickly. But I had a bunch of complications during recuperation, and I actually spent longer time in the ICU than average. I spent a longer time in the hospital than average, but I did get back to work in about the time that was predicted that I would. And I probably could have actually even gotten back sooner if it had been important to me. But at that point, I was happy to be recuperating at leisure.
Yeah, no kidding. Well, so a couple really good lessons that you've delivered. One is you got to listen to your body and not be afraid. I think sometimes I personally have thought, or I've known people who have thought, well, if I go in, I'm going to be so embarrassed when they tell me that it's nothing. But it's so much better to be told that it's nothing. Like, go in with the hope that they tell you that it's nothing, and you've not wasted anybody's time. Like, it's better to make sure that it's nothing. So yeah, you've got to. I'd like your advice to think, well, what would you tell somebody else to do?
Yeah,
Because you kind of get out of your own head, which is such a great idea. And
yeah,
then, yeah, and
and
then
in
to follow through, right? To
yeah,
make the appointment. Yeah.
well, in denial, I think people try to ignore the most obvious things. And I had like the most typical presentation of coronary artery disease. And I take care of heart patients all the time. And I mean, I've known since first year of medical school what the most common presentation of coronary artery disease is. And I've known about denial since first year of medical school. Yet when it happens to you, it's difficult to be as objective. So yeah, I would never have ignored what was happening to me if a patient came to me with those symptoms.
Yeah.
But
Right, exactly. So here you are. You've been on the other end of things all these years, all this time, where you're the doctor, and all of a sudden you're being doctored. And so, was the experience like you thought it would be, or what was different than you thought maybe your patients were going through all this time?
I think I was expecting to have a relatively smooth course. Now, of course, I know that complications do happen, and there are the sort of the known unknowns are the ones where you know that those complications happen, but you don't know if they're going to happen to you. And then there are the unknown unknowns or complications that you didn't even anticipate. And I had some of each. One of the things that was a surprise to me right at the start was after surgery, I had difficulty swallowing. Every time I tried to eat a meal, it became kind of an ugly bout of coughing and gagging, and it was just horrible. And I didn't know that this was a complication of that can happen with open heart surgery. Once I had an ENT consult I found out that it was a known complication, but I wasn't aware of it. So until I found out that it does happen, and I was reassured that it always goes away, or at least the ENT guy that looked after me said he'd never seen it last more than a month. And in my case, it went away in about 2 weeks, but it was a difficult 2 weeks. If you can imagine, every time you try to eat something, and if you can't eat, then your body can't heal as well, and it deteriorates. So I had to force myself to eat, but it was quite difficult. Liquids were a little more easier than solids. I could eat yogurt easier than solids, and I had to like chew till everything was very liquid before I could swallow. But it went away. And then there were some complications that I was aware of happen after this kind of surgery, but I wasn't aware of how severe it would happen with me. Now, any operation in the upper abdomen or in the chest can trigger the hiccup arc, so it can cause hiccups. And I was now when I was in medical school, I learned about hiccups, and usually they're a minor nuisance. Everybody knows has had hiccups,
Mhm.
but there are cases where people have hiccups for months and years, and some have even uh, died of respiratory failure because the diaphragm became so exhausted that they couldn't breathe adequately. Now today you'd probably put on a ventilator and that wouldn't happen, but the world's record, the Guinness Book of World Record for hiccups is 68 years, over 430 million hiccups. So after surgery, I started having some hiccups, which were annoying and a little more painful because there was an incision in the middle of the chest. But as the drains came out, my hiccups became worse and worse. And when the final drain came out, I had hiccups like you can't believe. It was hiccups on top of hiccups. It was just staccato hiccups that were just absolutely horrible. And for a day and a half, we tried, well, there are lots of ways of getting rid of hiccups. And I tell my patients to like swallow grainy sugar because that irritates the back of the throat and can sometimes stop the arc. But I couldn't swallow rapidly because I was having trouble swallowing. The other thing is lift up high and stretch as hard as you can and swallow. That again irritates the back of the throat and you can sometimes stop a hiccup arc. But after heart surgery, you're not supposed to raise your hand above your shoulders because it can stretch the incision. So I couldn't do that. So it's down to pharmacologic agents, drugs that can stop it. But the first couple that they tried on me didn't work. Finally, I got a very strong medicine that diminishes muscle tone, and it also makes you sleepy. So then I slept all day and all night. So they had to back up on that, and then titrated so that I wasn't so sleepy, but I wasn't having so many hiccups. And with that, we were able to get over it until that irritation passed and the hiccups went away completely without medication.
Oh my word. Yeah. It's interesting. Like, I find that there are times when a doctor doesn't warn you that, by the way, this can happen, or by the way, that can happen. And this is common or that's common. And so it can be really scary when you're having some symptom that you did not anticipate. You don't know where it's coming from. Like swallowing, that had to be really hard to think, what else is wrong with me?
You know, what to tell patients beforehand. It's kind of a dilemma. Suppose you had to inform somebody of all the things that can happen when you cross the street. Well, lightning can strike you while the street light thing falls on top of your head, while a car hits you while lightning strikes. It's endless, and you would never get off the curb. So I think the usual thing is to give a realistic idea. You can expect this, you can expect that. And then if people ask, different people want different amounts of information. There are some people who if I start telling them that this might happen, they say, no, just do what you think you should, doc. Some people say, and others want to know lots and lots and lots of bloody details. And so you have to individualize it. But you can't talk about absolutely everything that might happen because one, we don't know, and two, it's just an endless, as I say, think about how would you provide all the possible risks of crossing the street.
Right, right. That's so true. That's so true. So, something that I've realized in our medical system is you really have to be your own advocate, or you have to have somebody who is your advocate. You have to have somebody with you. Like, I had experiences where I've spent the night in the hospital with my mother-in-law or with my husband, whoever, because someone needs to be there. And which is different than the way things used to be. It used to be, I don't, we would just leave people there. Like visiting hours were over at 9 o'clock. Everybody's out the door, like nobody's staying. And now rooms are set up for someone to stay. What is the difference now, would you say, between then and now?
Yeah, I'm not sure how much of a difference there is. Now, in my situation, the first night I was out of the intensive care unit, uh, Cedars allows one person to stay with you in your room, but it's a fairly uncomfortable cot, and there are lots of hospital noises, and people come in to check the patient's blood pressure, maybe take blood early in the morning. So my wife got essentially zero sleep that night. And there is a, you do have to be considerate of your caretakers. And there is a thing called caretaker exhaustion syndrome, where people just wear out and burn out. And so after that first night, we decided that it would be in her best interest and my best interest if she went home and slept in our own bed so that she could be better rested and actually be able to do things she needed to do, but also better able to help me. So I think you have to be very cognizant of the needs of the people who are taking care of you and be grateful for them doing that. But in terms of the other thing that's really important is communication. Because when I first had my swallowing problem, I think the first day the doctors noted it, complains of swallowing problem. But after a couple of days, it was bothering me so much that I really needed to clearly communicate to them, this is really bothering me. This needs to be solved. And was able to get a gastrointestinal consult and get and find out what was really going on with that, and have a couple of tests which showed the abnormality and got the ball rolling on at least clarifying what was going on. So I think what's important is clear communication. There's a lot of medicine is from, it's taken, the history is as important as all the labs combined. So if somebody should tell you what's bothering them the most, and then that can be addressed. So I think, again, communicate clearly what's bothering you, and then that can get addressed. And if it's not addressed right away, then say again, this is what's really bothering me. Can we do something about it? And I had that in a couple of instances. One of the things that was prescribed to me was a very large tablet for potassium. Now, potassium is given after heart surgery because low potassium can cause arrhythmias and that can cause problems during recuperation. But this was a giant tablet that I had to cut in fourths to even try to swallow with my swallowing problem. And my potassium was at a normal level. So I talked to the cardiologist and said, look, this tablet is really causing me a lot of problems. Can we cut it out? And he said, well, you're going to have, there's a greater chance of an arrhythmia. And to which I said, well, I'm being monitored all the time. I had EKG monitors on all the time, and my potassium is in the normal range. And I understand that this would make sense when swallowing is not an issue, then I would happily take this tablet. But this is for sure causing me misery each time to try to prevent something that is likely not going to happen. Would it be okay if we stopped it and resumed it if there was a problem, or if my potassium went down, or if there were any arrhythmias? And he thought about it for a few seconds and said, okay, let's try without it. So
Yeah.
by telling him what was bothering me, that my situation was different than average, I had that solved. Now, you do have to be somewhat reasonable. And I have to say that there was one time when I was perhaps less than my normal self. Um, One day I woke up and they had they have wristbands to warn people of various things. And so if you have a difficult airway, they might put that. If allergies would be put on so that you're not given something that you might be allergic to. But I woke up and it said on my wristband, fall risk. Now, I'm a gymnast. I have great balance. I am not a fall risk. So I thought, what, who put this on me? And the nurse thought, well, maybe the night nurse put it on. I said, well, take it off. I'm not a fall risk. And I can stand on one leg. I showed him either leg. I can stand on my toes. And I said, no, 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 you might fall. I said, no, I'm not going to fall. I'm fine. Um, I made a bigger fuss out of it than it was worth because, I mean, it does no harm to have this wristband on. But to me, it was kind of a gratuitous insult. It would be like putting on a band on a musician that says tone deaf. It,
Mm.
it was unnecessary, and I later found out that this was put on actually before surgery because under anesthesia you might or sedation people might have balance problems. But this was 4 or 5 days out, and it was just the first time I noticed it, and my nurse didn't know when it was put on, so it became a a big issue to me, and I was probably a little more obnoxious about it than necessary because it did no harm. And in retrospect, I probably should have just let it be. But but
Well, that's okay. I mean, it's all right to I think I probably would have felt a little insulted too. Like I don't have an issue and sometimes if you're a fall risk, they don't want you to get up on your own and they want you to call to have help to go to the restroom or whatever it is. And so yeah, I mean there's all that stuff to deal with. But I think Andrew, what's interesting about what you're talking about is you're talking about being your own advocate basically. And so like with the potassium pill and it was just too large to take, there are people that look up to doctors and go, wow, doctors know their stuff. And so if a doctor says do it, I'm going to do it. If a doctor tells me and have a hard time asking questions or questioning, I guess, feel like they're questioning a doctor's choice, but so much of medicine is not so cut and dry. Each patient is different, right? Each case is a little different. So, what do you recommend to people to be able to open up conversation with their doctors?
well, everything depends on the proper communication. Now you have to realize your doctors and your nurses and you have the exact same goal. Everybody wants you to get well. It's in everybody's interest. It enhances the doctor's reputation to have you get well. It also makes him feel better that his patients are getting well. And of course, the patient wants to get well. So everybody's goal is identical. So approaching a doctor or a nurse in a hostile manner makes no sense. But clearly telling the doctor what is bothering you absolutely makes sense and will absolutely make your care better because that's information that's valuable to the doctor to know. They may not know that it's your knee that's hurting and not your hip unless you tell them.
Mhm.
And then they can look at where the problem is and address it and treat it properly. So clear communication, respectful communication on all sides is what's needed. And understand that it's in everybody's best interest for you to get well as quickly as possible and as well as possible.
Yeah, good point. That's a really good point. I have known times that I have to say, doctors can grow weary, right? I mean, it can be an exhausting job. ER docs, I mean, that's exhausting. A lot of different specialties can be very exhausting, but a doctor in general, I think, is exhausting. And so it seems like sometimes it can be easy to look at one patient as the next, and not dive deep enough or not listen all the way, I guess. Like for instance, my husband 15 years ago had stomach issues, and he knew it was a different feeling than he'd ever had in his life. And he was 51 years old, and it was treated with Tums. Just take some Rolaids, take some Tums, whatever. No tests, no anything. And so a couple months later, he went back again, the same thing. He just had this stomach issue that he knew was different, and explained to the doctor, this is different than anything I've ever had. And so we scheduled for 2 months later. A gastro person went to the gastro specialist and was told the same thing, take some Rolaids. Well, a week later, found out he had pancreatic cancer. And so it's like, I don't know if it's people that, or explain to me what you think that is. If doctors, if there's just things that are so rare that they just don't even think about a possibility, or should have run a test, or would run a test, or I don't know. I'm not sure what the answer is, but I feel like there are times that a doctor just really needs to hear what the patient has to say. And I think most of the time that happens really good, but sometimes it doesn't quite happen. And so what does a patient do, or what's your take on that?
Yeah, it's sort of difficult because there are lots and lots of things that cause abdominal pain. There are whole books written on the thousands of causes of abdominal pain. Pancreatic cancer, of course, is one of the worst things that can cause abdominal pain. And it's somewhat difficult to diagnose early because most of the time, by the time there are symptoms from it, it has advanced to the point where it's not we don't have a proper cure for it. So it's a difficult one to deal with. I think if you feel that this is different, then I think saying that is useful. It's useful information. Say, I've had stomach aches before. This feels different. This feels like it's something else. Could we investigate it further? Because it really feels to me like it's something else. Now, you have to understand that diagnostic tests are not risk-free. So if you're going to do gastroscopy or any kind of a study, there are risks involved in that. So you don't want to go whole hog on any minor complaint, because you can end up doing more harm than good.
Mm.
But if you feel that you have something that's different than you had before, then that's useful information for your doctor to know. This is not what the kind of symptoms I had before. This is something different. Would you mind looking at it from a different angle, because it feels different to me? I think that would be useful information, and I think most doctors would definitely listen to that and do something else to see what's going on.
Yeah, right. Yeah. So just making it really clear, I guess, to your doctor, and do a really good job of communicating. And yeah, that makes a lot of sense. So you went through all of this, and being on the other end and understanding, being understanding with your wife as far as caretaker goes, and seeing things from the whole other side. And so you decided you'd write a book and put some of your best advice in it. And the book is great, by the way. You did a wonderful job, and there's such valuable information in there. What inspired you exactly to write it? Because a book takes time. Like, it's no easy task to just sit down and write a book. So what inspired you to write it, and what do you want people to get out of it?
Well, while I was recuperating, while I was going through all this, I realized that I was learning quite a bit from this experience. And I thought that, other people might benefit from what I was learning. And so I thought that it would be useful to have a book outlining the things that can happen, and basically to help people get over denial, and then emphasize that the clear communication is very important all along the way. So a lot of the things that we were talking about are in the book, and I realized with more clarity some of those things as I was going through this process. And I also, there's sections in the book that are from my wife's point of view, because she's probably the person most changed by this experience besides me. And it so I think that experience is also helpful. And some of it is kind of interesting. Now, in her case, her background is Chinese American. And the first thing she thought about, now, this actually happened a few months after we got married. And the first thing that she thought about is in Chinese legend, a woman whose husband dies shortly after they marry is considered what's called a super scissor, that she had somehow cut his life short. And so one of the things she thought about is that she didn't want to be thought of as a super scissor.
Oh,
So,
wow.
so that was, besides wanting to help me get well, that was part of her motivation. Is that she knew that her Chinese friends would also remember that legend, and apparently in old China, those women could never get married again. Sometimes they were even killed. So it was as a kind of like a witch in Western culture.
Yeah. Wow. Wow. Yeah. So the things that you discover about each other, I guess, right? And
Yeah,
yeah.
and I actually I think I heard you talk about how you had some intimate times with your husband when he was sick and you were sick, and actually my wife said that we had more time together when I was ill because I wasn't working at all, and she cut down on her work schedule, so we had a lot more time together. And she said that sometimes she misses the intimacy that we developed during that time because we had so much, we shared a lot. We were
Mm,
together a lot and we shared a lot. And so in some ways, this bad experience helped bring us closer together. And we had a good relationship to begin with, but I think it became even better because of
yeah.
that.
What a beautiful thing. And I think going through tough times, it kind of does one or the other. It's either going to bring you closer together or tear you apart. And not being married for that long, and then have it happen, I think it's like your relationship goes 10 years faster, 20 years faster, like you're 10xing the relationship, all just because of the circumstance.
Well, I think a stress reveals character. And I I felt that my wife had strength, strength of character and was a kind, good person, but she proved it in spades. So that was revealing to me. And I think what she would say is that she saw the determination that I faced in in doing the exercises I needed to do and just doing everything I could to get as well as quickly as possible. And so we saw, I guess we saw things in each other's character that we admired.
Yeah, that's wonderful. Yes. Yeah, and caretaking is not an easy job ever. And like you said, there's, fatigue that happens, and so we got to be kind to our caretakers.
Oh,
Realize,
absolutely. It's a very difficult thing, and because it 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 it's a strain. It takes a lot of time, a lot of effort, and it can be tiring. So there is a thing called caretaker exhaustion syndrome, where people just burn out after. Now, mine, I was back to work in 12 weeks, but sometimes caretakers have to do it over months and years, and it can definitely wear on you. And so it behooves the person being taken care of to show appropriate gratitude for what's being done for them. It's a two-way street. And I think if you do show gratitude, it becomes easier for the caretaker to do what they have to do.
right? Yeah, exactly. So true. Okay, so you had to come up with some inner strength. Open heart surgery. I personally, I can't even imagine it. It has to be one of the toughest, if not the toughest surgery to go through. It's just so hard on your body. I mean, what has to happen to open up your chest and all of that and the healing process. And so, you've obviously got some inner strength to pull you through that. But did you have faith? Did you have something else that you were also getting strength from?
Well, I've read Viktor Frankl, and he's a person who survived the concentration camps through the Holocaust. And what he said is that the people who survived were ones who had something to survive for. They had some goal. And in my case, I had a life that I really enjoyed and I wanted to get back to. So my primary motivation was to get back to the life that I had before, and to be able to do things that I was able to do before. And yeah, I think you're asking about sort of spiritual and religious things. And I was not raised in a religiously observant household, but I was definitely raised in an environment where uh, treating your fellow man as well as you can. In other words, the golden rule, treat others as you would want to be treated, was definitely emphasized. So I did, I felt that from this experience, I should, if I can do something to benefit others from what happened in this, I wanted to do that. And that was the motivation for writing the book, is to take this difficult experience and make something positive out of it. I thought that would be kind of a jujitsu move that would be worth taking. And that's why I put the effort into writing this book, which was a lot. It would have been a lot easier for me to spend that time taking care of patients, actually.
Yeah, no kidding. No kidding. So, and which is such a gift that you did take the time to write this, because yes, my word, it's going to be so helpful for so many people. And it's always uh, interesting to read, to know what maybe somebody can anticipate, or that somebody else has gone through the same thing and has gotten through it. And so I think, yes, in so many ways, your book is golden and so helpful. And coming from your perspective, you're not just a patient, but you're a doctor and a patient. So you have both sides of the coin, which makes it very unique and a whole different read. And it's so good. So I really appreciate you taking the time to do it. Was it therapeutic? Like what did it do for you to write? Anything?
Yeah, I think I wanted to re-examine my experience. And so writing about it is definitely a thorough re-examination. And I think that is very useful to re-examine any important event in your life, to see how it changed you, how you dealt with it, how you might deal with it differently in the future, and in similar crisis. And I would say one of the things in re-examining my situation is I would, if I had a fall wristband on my arm, I would try to take it in stride a little easier than I did the first time around.
Yeah. So what would you say are like some of the biggest lessons you learn? One is that go with the flow a little bit more. If it's not that big of a deal, let it slide, like let it go. Do you find yourself in life in general that's now a change of attitude for you? Like, are there differences in you now than before?
Probably, I'm probably a little more relaxed about some things that might have bothered me before. The other thing is that I felt in this sort of re-examination of life, I thought, okay, I want to be a positive influence on people that I meet. And so I do make more of a conscious effort to to be to try to be kind to people, to thank them when they do something nice for me. Now I think I did a lot of that before, but I'm more aware the necessity to do that now. So I think I do it somewhat more than before because I have the mindset that that's something that I should do.
Mm, yeah, that's a good point. And there's so many things that can happen when you go through something and get on the other side of it and go, wow, I just want to be a better person. I just want to be healthier. I want to be stronger. I want to be nicer, kinder, and all the stuff. So what would you say like are the kind of the biggest lessons you learned in the whole process?
Well, I think the most revealing thing to me from the start was that I'm not immortal. Now, of course, I knew that before, but it never hit me quite the same way before. You go about your life and you don't necessarily think about what your overall life arc is going to be. And I think an event like this, a stress like this, forces you to think about that. And I think for me and probably for most people, you'd come away thinking, okay, I want to be a better person. I want to make a more positive impact on the people that I come in contact with. And so that's one of the things that I definitely took away from it is just to be more aware of how I impact other people and when in doubt, uh, go to kindness.
Yeah, yeah,
Or
yeah.
or as you say, go to love.
That's right. That's right. Love kind of always wins. So
Yes.
it's the great default for sure. Kindness and love is kind. So
Yeah.
that works out pretty good. What do you think your wife would say are some of the biggest lessons she learned or some of the biggest things she learned through this?
Gosh, I, hmm. Have to think about that a little bit. But I think, uh, oh, she actually has talked about that. She said that usually she was a pretty strong-willed person. So when she was in an argument, she would stress her point and make sure that she kind of won her argument. And I think through this, she decided that, there are things that are more important than winning arguments. That having the relationship and having the love is more important to her. And so I think she's become more mellow as a result of the experience.
Yeah, wow. That's so interesting because I've seen that happen before with people that it's like your priorities change or you get a different perspective basically on life and realize what really is important and what's not so important anymore. I remember years ago, I was probably 15 or something, and my mom said to me, Kim, you don't always have to be right. And I was like, what? Why are you saying that to me? But it was this realization of yeah, I mean, there are some things worth arguing over, I guess, and other things where you go, who cares? Somebody says the sky is purple, it doesn't affect me. Like, who cares if that's what they're saying or that's what they say? It shouldn't matter. And so, giving grace again, kind of giving grace is a wonderful thing to do. And so mellowing out and putting things into perspective certainly changes things. How has your life changed? Like, are you uh, doing different things than you think you would be doing right now?
Let me just get back to one other thing in that an illness, like a major illness, is a family affair. And that's why I do talk about how it did affect my wife. And I had to think about it for a second, but she said that to me. And so that is kind of an important thing that her her outlook on life has changed as well uh, because of this. Uh,
Hmm.
and then what was your question again?
Just as your life changed at all, are you, doing different things? I just have known some people who had this bucket list that they're going to do someday, or had this thing that they're going to do someday, and then go through something where they realize they don't know if they've got someday, so they kind of do it now. Have you had anything like that?
Yes, I've wanted to write about my family's history, and I'm actually in the process of writing about my family's immigration history, because there were several what you have to call minor miracles along the way, where at one point a complete stranger came up to my mother, and we were about to check into this hotel, and and said to her, don't check in there because the AVO, which is the Hungarian KGB, goes through that hotel every night and you'll be arrested for sure. I want to do a good deed. You can stay at my house tonight.
Oh, wow.
And that
Wow.
was on our way to escape. So there were several minor miracles along the way. And then I think I do want to tell a story. Sometimes we hear how Americans are not kind to immigrants, that they mistreat them or make fun of them. And that was totally not my experience. Uh, I was in Los Angeles, and my classmates were welcoming. My I think the teacher the first day talked to them about the Hungarian Revolution and told them to be welcoming to me. And I really had a very positive, and I think as easy as possible an immigration experience. So
Mm,
I
good to
think I
know.
want to write that because I am grateful to America for having been so welcoming to my family.
Mm,
And
yeah.
and I and as a result of living here, I've had an easier life than I think any of my ancestors did. So
That's good. That's good to hear. It's good to hear. There's lots of good people. I think, in general, people are just good people, and kindness is just innate. And so just better to be kind and nice. And so I'm glad. I'm so happy to hear that you had a good experience, because I think sometimes Americans do kind of get a bum rap, and thought about differently even around the world. But people I know are kind.
but I
So,
think part of the thing is you get back what you give out.
mhm.
And um, before we landed in LA, my father called my brother and me together and said, okay, uh, my name Miklos in English, that's Nicholas, and I'm going to go by Nick or Nicholas in America. And your name Andras, that's Andrew in English, and you should go by that because it's going to be easier for you. You're not going to have to explain your name all the time. And it'll be easier for Americans because they won't have to learn an unfamiliar name and try to pronounce it. So we were, and basically the message overall was, we're not coming here to be Hungarians in America. We're coming here to be Americans. And I think
Mm.
that attitude, people wanted to show us. I mean, let's take you to the 4th of July fireworks. Let's show you what Thanksgiving is about and things like that. So yes, I think it's a two-way street. And we were eager to become Americans, and Americans were eager to help us become Americans.
Oh, wow. Wow. I love that. I love that.
That's my next book, not this one.
There you go. Good for you. So, where can people get in touch with you? How can they get your book? How can they find out more about you?
Okay, the book is available in lots of bookstores, but probably the easiest is via Amazon. It's called Getting Better: A Doctor's Story of Resilience, Recovery, and Renewal. And I also have a website. It's called gettingbetterdoc.com. So it's like those words, gettingbetterdoc.com.
Perfect. Perfect. Yes. So buy the book. It's really good. Andrew, thank you so much for your time. Thank you for sharing everything that you did. Thank you for being here. And I just wish you and your wife just the best and lots of happy years and lots of wonderful things. And thank you everybody for joining us today. I know that you probably got a lot out of what Andrew had to say. And so thank you for being here. And until we see each other again, be blessed.